Hello, everyone. Welcome to another episode of HealthTech with Purpose podcast. Today's guest is Dr. Pinkey Patel, and she is one who is really making great waves in the maternal mortality space. Something I believe today she's like her company, Myri Health, is very synonymous with this space because of the great outcome that they have been able to showcase, with the various partners they are working with. And I thought that this would be a story bringing to a podcast would be worth for all of you to connect with and to learn from it. So, with all of us together, hello, Pinky, how are you today? Welcome to the podcast.
Yes, thank you so much. I appreciate the invitation and the opportunity, and I admire the work that you're doing in healthcare on the other end, right? So, just really excited to share more about what we're building.
Sure, sure. So why not we start right from a bit of background first? I know your background has been into clinic as a clinical pharmacist, and then a bit more specialization into the pre and postnatal corrective exercises, etc. But then, what inspired you to found Myri Health? And
Yeah.
in fact, I was reading you had a very interesting personal experience story. Would love that you share it here.
Absolutely. So I don't think any founder wakes up in the morning and goes, "Hey, I want to build something really hard, make less money, and work more hours." But my background, yes, like you said, I have my doctorate in pharmacy. As a clinical pharmacist, I worked for United Healthcare for 13 years. I also, alongside with no relationship, am a personal trainer, then eventually became a pre and postnatal corrective exercise specialist because I questioned how can a woman reorganize her organs for 10 months, have a baby,
Mm,
walk out of a hospital without a manual, and then magically be cleared for all exercise, and then say, "Here's your baby." So I
mm,
had my own two children. Ayush, I know you have a 9 and a 5-year-old. Mine is also 9 and 5. And I navigated that with health insurance, resources. I hired a
mhm,
doula. And even then, I felt like I was very underserved. And I found myself in rooms where I was challenging individuals to have my birth the way I wanted. And I did a lot of research. I'm a good homework. I'm good at homework. I'm good at studying. So I thought, let me watch the businesses of birthing. Let me watch these things. Why is America, as such a developed nation, have one of the worst
mm,
maternal mortality outcomes? And I am giving birth here as a brown woman. So I had questions, right? So basically after I had Karishma, I had a 60-hour unmedicated labor. I found myself in a crossroads with some people saying that let's just throw her in the OR, give her a C-section, get her out of here. That may
mm,
seem minute at the time, but there's a lot of things, a lot of people pay the price for that, and women pay for the price for that. So I found myself after that, through that journey with Karishma, wondering if this happens to me, what happens to other women? And why are we not talking about it? So that started the curiosity. We
right.
don't need more point solutions. We needed infrastructure, which is where Myri came. I wanted to build Myri to be the connective tissue between mothers and the systems and the providers. So then I built the Myri came out as this D2C application. We
Mhm,
reverse engineered everything. It wasn't the typical go-to-market strategy, which I think worked in our favor. We built an app in stealth in beta, and I launched it 3 weeks before delivering my son. I don't recommend that, but you kind of just jump off a cliff and you build your chute on the way down. We garnered over 6 figures of users over the first couple of years, and we built it slowly at the time. I bootstrapped it, and it was a postpartum application, and we really learned user behavior and collected a lot of data to understand what
mhm,
is missing. So yeah, that's how it all started. And then I actually did both for a couple of years, and then I went full time at Myri 4 years ago. Yeah.
mhm. So one of the things that I would like to go a bit deeper is, like you said, that US being one of the developed countries still has such high mortality rates. So when you did your research, what did you find in that? Like, what was the reason of this big gap in care?
Yeah. So there's a few reasons, right? And I sit in a state has that has one of the worst mortality rates in the US. So even more, like we're not even at the top. A few things for this. There is a lack of preventative healthcare when it comes to in general. I think we all agree that we're more reactive than we are preventative. And so getting
Mhm.
upstream, there are so many things that we can prevent if we actually provided and standardized care. Yes, as a founder, we can't get to the policy level, but there's a lot of things
Mhm.
that have been normalized as a standard of care. If you don't
Mhm.
have a high risk pregnancy, for example, and you're walking
Mhm.
into a regular pregnancy, you may not even see your provider until 12 weeks of pregnancy.
Mhm.
Foundations of the organs grow in the first 0 to 12 weeks. I think
Mhm.
that even before you become pregnant, there's a lot of work you might need to do, like management of
Mhm.
comorbidities, diabetes, hypertension. We don't have that kind of lens on the mother. And then the second
Mhm.
piece is we have standardized the fact that when a woman gives birth, you first appointment is for baby. Everything is, unless there's an aunt or a WhatsApp group or a village of some sort, or you might find a chat on an app, you're left at the mercy of figuring it out yourself until you get to your 6 week appointment. And there you are managed at an average 11 minutes for mental health,
Mhm.
physical health, and cleared for everything. What happens after
Mhm.
that appointment? It could be postpartum depression that goes unnoticed. There are just not that we don't have those kind of points of like, okay, a 12-month check, an 18-month check. It's not done after 6 weeks. So it's a lot. And also the fragmented care system that is healthcare. Like a
Mhm.
mother is you're looking for a lactation consultant, a physical therapist, you've got a pediatrician. Our system is not designed for everyone to talk to one another. So that causes moms to
Mhm.
fall through the cracks. Yeah.
Mhm. Great. And would you like to complete this with a bit of a product, roadmap of Myri in terms of like how Myri comes in at what stage and then how it fills all of this gap?
Absolutely. So we say Myri Health is now evolved into maternal infrastructure that's designed to predict, prevent, and
Mhm.
personalize care from pregnancy through postpartum. And we
Mhm.
utilize clinical technology. It's not chat GPT in a wrapper, but we want to utilize AI to engage mothers in real time. So the moment she's
Mhm.
got her 2 lines on her pregnancy test, we're wanting to understand her holistically, doing
Okay.
remote monitoring, detecting
Mhm.
early warning signs, and plug that data directly back to systems around her. So whether it's a health plan, whether it's a provider, whether it's public health. So the goal is getting the mother utilizing remote patient monitoring to understand her health holistically. Even at the very least, if she has an iPhone, she has an Apple Health Kit. She doesn't have to have
Mhm.
fancy wearables, but we can connect with blood pressure and blood sugar devices. Getting all of that
Mhm.
data and staying ahead of it and identifying something before it happens is key. The second key is connecting a provider in some capacity without adding more work to their workload because providers are also burdened. But unlike point solutions that start with a dashboard, we started with moms. We got their trust because AI is only going to do as much as it can on its own because real engagement is the only path actually going to drive action, right? So
Mhm.
we're no longer just an app. We've expanded into dashboard analytics to support community organizations, providers, health plans, and health systems.
Mhm. Great. And you mentioned AI a couple of times. So can you share like what kind of AI empowers Myri's experience and like maybe expand on that, like what kind of value AI creates in this cycle for Myri?
Yeah, so it's a layered AI model, and I think my CTO would be he always gets excited to answer this question, but it's behavioral AI to start with, right? To understand and predict engagement patterns from mothers. Our system learns when a user is most receptive to nudges, content, care recommendations that drives our trust loop and makes it
Mhm.
better. So this is critical in maternal care than in anything because if a mom doesn't feel seen, she won't come back. Critical
Mhm.
risk or clinical risk stratification models. So trained
Mhm.
on evidence-based inputs and validated by clinicians to flag early signs, things like
Mhm.
preterm labor, postpartum depression, hypertension, and other maternal complications. These models were designed with culturally competent care at the root of what we're doing because we've done a lot of work with underserved populations, and
Mhm.
accessibility makes a lot of sense whenever you have language availability, right? 77 languages. Are you delivering cultural competent care, not just an umbrella of content? And then we're also focused on value-based initiatives there as well. Natural language processing for sentiment analysis and triaging through self-reported symptoms. That's allowing us to detect distress, burnout, escalation without warning, and then even personalization in engines. So think recommendation systems, but for maternal health. So based on the clinical stage, their behavior, their social determinants of health, Myri would deliver adaptive content, reminders, and
Mhm.
care navigation tailored to their needs. So we're not building
Right.
a chatbot to answer FAQs. We're really trying to, we call ourselves maternal tech infrastructure to help a mother recover faster, avoid complications, and get that help and intervention at the right time.
Right, right. And I believe, like connecting all the information would become like core of it because one of the gaps, like you mentioned, the reason is that the systems are not meant to talk to each other. So, filling this care journey, it is important that you are connected at every touch point of the
Touch
patient.
point. Exactly.
Yeah. So, I would like to switch gears to a bit more on the go-to-market aspect of Myri and, like what has been your go-to-market and if you can share like a go-to-market at different phases of your journey, that would be interesting because one thing you mentioned was, you started first with the application that the users downloaded, but then, over the years, how have you uh, as the company moves into different orbits or different scales, how have you shifted between different go-to markets?
Yeah, and it wasn't linear because when you go to a VC, they'll say go B2B. Everybody has their opinion of you should go to market, and I'm like, you should go to market however you feel comfortable. And I think there's so much value in data and understanding user behavior and trust. We always forget that this is a very vulnerable population, and you can't
Mhm.
throw fancy software or gadgets to mothers. They
Mhm.
need the trust of humans, right? At some capacity. So it wasn't linear. It was very iterative and it was very intentional. So we didn't just do a random pivot. We listened, we built, and then we evolved for mother, and then we built, listened, and evolved for provider. So when the first version of Myri came out around the pandemic, right when I had the baby, I think you had your second one around then too, and
Yeah.
that was a very
Right.
interesting time to have a child. I think all of us are still kind of recovering from that. It was
Mhm.
raw, it was imperfect, and it launched in just a few weeks before I gave birth, but people downloaded it. That phase wasn't about scale, it was about validation. And then we
Mhm.
captured that data, real world use cases. You'll find those testimonials on our app store, and then built that trust loop. So then we realized that for quickly solving maternal health at scale, it's going
Mhm.
to be, we want to meet more moms. How do we do that? So you have to integrate into different ecosystems. So we were met with actually conversations with employers, and it made a lot of sense for me then because I know that when I had a maternity leave, America has one of the shortest maternity leaves in the entire world. And employers were wanting to get their moms back in a better capacity. So we had the opportunity to unlock some enterprise engagements where we supported the mothers at return to work to show that there's less absenteeism, better productivity. And then that is when we realized, hey, there's some data that we're collecting. And we added to our data and said, it's improving NPS scores, it's improving, we've recognized claims data that they're utilizing certain claims less and ICD-10 codes less. We're improving their pelvic health. That's something we really did postpartum. We do that really well with pelvic floor therapy. Then we started to realize, okay, to reach even more mothers, we're going
Mhm.
to transition from a standalone app to data-powered infrastructure layer. So then we rebuilt the platform in the last 12 months to be enterprise grade, to be compliant, which took time, interoperable, and then built for health systems. So today our go-to-market is now positioned to still staying true to our preventative care at the root. So when we work with health plans, what is the goal? To provide every beneficiary of childbearing age Myri so that they're able to be preventative and not reactive and then reduce costs downstream. When we talk about Medicaid partners or public health, we work with a lot of underserved populations. And that is because at the core root of how we built it, we want to be adaptive and be able to understand and provide culturally competent care so we can reach more moms through public health. And then even when we're talking about health systems. So when we talk about EHR integration, well, that's great. You are now met with another, consumers are hard enough to get. But when you have a provider who's already busy and has so much work to do to manage mothers and other patients, how do you meet them with something that's frictionless that makes their job fundamentally a little bit easier, right? And spend more quality time with the patient. So now we are working with them to integrate more value-based care programs and remote patient monitoring. So our platform moved from being a feature into more of that maternal technical infrastructure. But I guess you could say we started with moms and then we evolved to meet where the system is operating. And now we're that connective tissue.
Right. Right. And yeah, it all makes sense. Like you start by first building it around your real user and finding the product market fit, and then evolve into more of the hyperscalers, basically. Of course, easier said than done. Great.
Easier
So,
said.
yeah, one thing, in fact, I would really want you to expand, Pinky, is, navigating the challenging landscape of securing funding. One, especially in the context of, current market. And second, as a female founder, historical data shows that it is always tad more tougher than if you are like all male team, etc., and so on. So
Yeah.
tell us more about your funding journey and what did you learn, and maybe the top key giveaways that you would like to give to fellow women healthpreneurs.
Yeah, so I'll be real with you. I taught myself anything about fundraising through YouTube or reading back in 2021 when I thought, what is this VC funding? Because I was like bootstrapped, working full time, paying for it myself, which I think there's a lot of value to that because at that point there was something called Clubhouse, if you remember. And I
Yeah.
remember changing diapers and going into pitch because they couldn't see what I looked like. They couldn't see that the house was a complete disaster with these babies and no one was going to school, but I learned how to pitch by literally throwing myself in these rooms. And I was like, what's a
Nice.
speed note? What's a cap table? What's a term sheet? And it was just, I just learned. And then I started putting myself in pitches and you learn a lot about that. And I learned pretty quickly that it's always a tough time to fundraise if you're a female founder, because, we can sit here and throw the stats around, but in 2023, female only founding teams only got 2% of venture capital. If you're a woman of
Mhm,
color, that is even less. Um,
mhm,
so the bar is set higher, the checks are smaller, the investors are clinging to safe bets. I have been asked to show way more metrics than any of my male counterparts. My traction is
mhm,
never enough traction, which I think data speaks for itself. Women-led teams and women founders do have one of the larger ROIs downstream. But being a
mhm,
first-time female founder in a healthcare niche, most investors have never experienced, the funding gap got wider. So the nuance that
mhm,
no one tells you is that it's not that we just get less capital, it's that we have to have more receipts, more resilience, more traction before you even get into the room. And so
mhm.
finding my way to a room without any network, it's something that honestly speaks for as a founder itself, right? Everything is, I tell my
Right.
kids, everything is figure outable. And I don't come
Right.
from a VC background. I don't come from an Ivy League school. I have my doctorate, but I do believe, and this comes from my parents immigrating here from India with $7, is that like anything is possible. So I think that mindset, has really helped. But I have been asked a lot of questions, in terms of emotional stability when men are being celebrated for being family men. You have to walk the line between mission driven and monetizable because you have
Mm,
to be monetizable. So I led with numbers. At the beginning I bootstrapped. I worked full time to fund the business. I slept less. I worked at night after nursing my kids and they were sleeping during the day and I worked my day job. That is how I did it. And then we led with numbers. We didn't just say we're helping moms. I showed them how to reduce claims, how to integrate into value-based programs, showed proof and data and outcomes because that turns into ROI. So we've been very capital efficient. We built lean teams and we secured early smaller contracts that then allowed us to show data and outcomes. And then we found aligned capital. So we did get our first few VCs and strategic investors, and we stopped really chasing investors. We just, they didn't need a crash course on maternal health. We were looking for partners. And at the end of the day, no check is equivalent to the other check. Money is money.
mhm.
I also protect my
No.
cap table just like I protected my family. And so, at the end of the day, you leave term sheets, you leave checks on the table because they don't align with you, and you work harder and you try to get another pilot and you work with this team that you can scale while being lean. I don't think the lack of funding is ever a sign to quit. It's the reason to build differently, in my opinion.
No, it shows a lot of grit on your part. Very motivating, I would say. Because, like you said, it's tough, but anything is possible if you feel it's possible and you are ready to work hard for making it possible. So
Yeah.
kudos to you and the courage that you have put on it. Yeah.
You.
So
Yeah, I would say we don't want to be rescued by funding. We're building a company that deserves it. And I also have a daughter that's watching me build this. So I also have other important work that I'm doing, right?
right, right. No, of course, as they say with children, they learn the most when they see you doing rather than you tell them something, for example. So, it's for them to see also. So you are, of course, growing a household of people who are ready to work hard for the dreams that they want to achieve. I think
I always call
that's
them our,
our.
I call this age that you and I are in with our kids the seed
Mhm.
round, because we're seeding literally everything they're learning.
Right. Right, right. By the way, good remembrance of Clubhouse. Indeed, someone learned something because
I
it
know,
was such a
right?
big
Clubhouse
hype and
serves
then
some
it
purpose.
just went away. Yeah, great. So, in fact, Pinky, why not you tell us your favorite story or your most inspirational story? Something you heard from your customer or your end user about Myri that inspires you till date.
So I think a little bit, not a lot of it. I'm also a social media influencer. And that didn't happen
Mm,
because one day I opened the app and said, this is really cool. I want to post really awesome videos. It happened because 13 years ago, I posted about my bodybuilding competitions and I
mm,
shared my love for fitness. And then before I became a mom, I said, hey, I think this is really crazy that everybody's talking about all these changes to body. I'm going to become an expert in this. I shared that journey. That then evolved
mm,
into me sharing my voice authentically on Instagram saying, none of this is normal. And other moms said, me
mhm,
too, me too, me too. And there's a little backstory to Myri. I actually built a consultancy before I ever built an app. So I built a
mhm,
six-figure consultancy where I worked with women, and it was a service business that I started. And I was able to get direct feedback on what was missing, and it helped me build. Actually, there's a little bit backstory, but the most feedback that I got was through that engagement, and then when I started to build Myri. So there were
mhm,
moms that, we ran a few campaigns through social media, and the beauty in all of this is you can have little money and sit on the internet and share a story that is like you can sell based off of your story. And because other women
mhm,
resonate with it. So they would say time after time, even when I was building Myri in like the worst, now I say the worst because you always look back and go, dang, like this could have been way better. But everybody starts somewhere. Okay. And so they were like, hey, I didn't know about this. Or I was in the community and I was chatting and I realized I had postpartum depression and I had no idea. Or,
mm,
oh, I didn't even know that I had this scar tissue from C-section and my back pain was because of this and I was having pain with all of these other things. Or, I was actually um, there's a lot of mental health, personal things that women have shared with me because they have confided through my direct Instagram because they know I'm the founder. And they've said, hey, Pinky, I was reading this and I asked my doctor about it, but I would have never brought it up if it wasn't for Myri or something you shared. So
right.
hundreds of those testimonials that are directly from the mouths of a mother that trusted our platform that I was so grateful to have, even when we were just like, I was like, here, have it for free. Or they were paying for it. And I was just like, oh, you have a bug? Have it for me, I'll refund your money. Like that's how you really build that, it's like these women are the busiest creatures on the planet when they're postpartum. We don't even have time to take a shower. So when they
Mhm,
were trusting me to do that and they were sharing their stories, like I hold those so close to my heart. And
mhm,
those to me resonate more than any, oh, look at what she did with this health system, or look at what she did with this pilot. Like that's my why. Yeah.
mhm, mhm. Nice, nice. And one of the things, on behalf of a lot of non-technical founders, I would like to know what was your way to get your application coded and, get the software running? Because from what I get from your background, you were not the developer, or were you? I mean, please
No,
tell us if you
are
had that
not adding
superpower
that to the resume. When I tell you our CTO now, he was the one that I reached out to when I said, hey, you build apps, right? And I was
Mhm,
like, and I was like, you do all this engineering and stuff too. And you're really smart. And I reached out to a lot of people around then and I was like, I don't know how to code. I'm not trying to code. So he actually was the one who built the first iteration. And he wasn't our CTO because I
Mhm.
was still figuring it out. He built it, I paid him, and then he came on and now is, he's part of our founding team because
Nice.
and so I am not going to take the credit for coding. I think one of the biggest things for a founder is you identify what you are not good at and you arm yourself with that army and then you run with a vision. So no, I did not code
Yeah.
this, but I am certainly very non-technical and I have, when I was pregnant and he would be building, there's something called pregnancy brain and I had a toddler and I was like, okay, explain this to me again another way. It's like I feel like found like the I have so much respect for engineers and the entire technical team of any startup that there's just so much pivoting and things that happen, but there's isn't a lot of language. I speak science, I speak physics, calculus, pharmacology. This is another language for me. Yeah.
Right, right. No, of course. I mean, I know like any product is, a culmination of the people, aspirations and hard work behind it. So, I can imagine that just like they say, like something on the lines of that you need a village to build something kind of stuff. So, you need the whole crew. And as a leader, of course, finding the best people to join is your job as the CEO.
It
So
is. It is. And at the beginning, a
so
lot of founders will say, I can't delegate. I can't delegate. Obviously, if you're not a technical founder and you want to build a tech digital health company that's technical, you have to
yeah.
delegate that. And you have to find others that align with your vision, that trust,
Mm,
that can also swift rapid, they can be ready to move and be agile. And then there's other parts of the
mm,
business where eventually when the time comes, yes, at the beginning you do have to wear a lot of hats, but you should
mhm.
be able to delegate at some point to
Right.
scale. Yeah.
No, true, true. That's been my learning as well over the years in my own company. So, yeah, I mean, that's how we can only grow. Like we can take care of building the future and have a team that can back us up. On the background. I think that's how companies are built. In fact, that takes me to my next question, which is like, where is Myri Health headed? What's new? What's next? I do see a lot of great progress from your social media. Like I was seeing recently, you were at this in the GCC area at this big conference. So tell us more about what's happening at Myri Health.
Yeah, so we have a few parallel commercialization strategies. Obviously, I'm in the US, and when I built this, I always said motherhood is universal. And that's the Delulu in your founderness. You're like, the mother that's across the world is still, she may not speak the same language as me, but she's still experiencing on a very different levels. I'm sorry, on the very same levels of going through this experience. And so that was 5.5 years ago. So last year, at the end of last year, I had the opportunity to go out to the Middle East, specifically into the region of Saudi Arabia. And we were chosen for the top 100 companies out of the world for something called Entrepreneurship World Cup. And I found myself in
Oh,
Saudi. And I really took that opportunity for the week to understand, honestly, blown away by their hospitality, had no expectations walking in. Parents are from India, have never been to the Middle East. But I thought to myself, when I started learning about their culture and learning about their infrastructure, it aligned with what we were building. And I took that opportunity to not just, to really understand what their goals were as a region, because they are moving quite rapidly in terms of innovation. And so we
that's
built those
great.
relations. Yeah, they're doing amazing work out there. And so that kind of unraveled into me going back again to Dubai for another conference, a health conference. And I would have, I think, getting on a stage and pitching, right? I will never say no to a stage. I will never say no to a pitch. I will always share what we're building. And so I was able to go back again and we were able to build further relationships. And in the last 4.5 months, we've started to expand in a few specific regions there. It's quite broad. You can't just say I'm going to go expand in the Middle East, but we've been very fortunate to bring on some key strategic advisors from the region. And with kind of their direction and strategy, we have several MOUs signed. And so we have a kind of a commercialization strategy that's going in parallel in the Middle East right now. So that from a expansion angle, we're really excited about that because we feel like they really align with our mission of preventative healthcare. and we're culturally adopting our platform to be able to support their moms. In terms of expansion of Myri, we're expanding into value-based care. Really, the goal crystal clear is the common denominator of Myri speaks to a healthcare provider or a mother in Oman, as it does here. We want to produce measurable reduction in the total cost of care and complications. So really trying to deepen our EHR and payer integrations, right? Building something that's encryption safe, FHIR-based integration layers, really scaling them and thinking real-time alerts and automated workflows, and then launching adaptive AI capabilities, right? So social determinants, peer support matching engines. And I think we're kind of at that seed base, right? And continuing to get our enterprise grade tech and compliance and earning certifications to be able to support these mothers and providers.
Lot of things on your plate. I hope you still sleep 6 hours at least.
My Aura ring is we get into little arguments sometimes because it tells me, what did you do last night? And I am getting better at sleep because of the Aura ring. Yes.
Nice. And because, you just mentioned you're building for the East, for the West, and, a lot of things, both on product development as well as with your target customers. And then there is personalization, then you have to get on the stage. So
Yeah.
I can just
There,
imagine. And
there
then there are kids at home.
Oh,
Yeah.
the ruck is at home. The management of there are systems in place, and that is a whole nother podcast, but there are systems in place to ensure that I'm still a present mom. I'm in and out where I need to be, or sometimes I take them with me. I think
Mhm.
that's just as much valuable as it is, for them to be in school is to see what we're building. But yeah, they're little, so I have to prioritize being a present mom because at the end of the day, what good is all of this if I'm not able to be a mother to my own children?
Okay, nice, nice. No, very inspiring, Pinky. So, we have come towards the end of the podcast. I do have some rapid fires for you. One-liner answers probably. So let them shoot them to you as soon as you're ready. Let me know.
Yeah, go for it.
Great. So, work from office, work from home.
Split. So CTO and I meet once a week at our co-working space, trying to save money right now. So we both work from home a little bit, and then we'll be expanding soon. But I got to get out of this house sometimes just to be able to work from a different space.
Makes
Yeah.
sense.
Yeah.
Why the name Myri?
We actually started as a company that was called something else. It was called the Snapback. And Myri, I feel like there's some cultures it stands for mother. And it actually, for me, it was my recovery, my postpartum, my pregnancy. So the my showed autonomy over the
Uh,
experience of the body. Yeah.
mhm. Okay, nice. No, that's very nice. Um, if you could achieve one major goal for Myri Health in the next year, what would it be?
It would be to go live with a few of our first value-based pilots and fully
Mhm.
commercialize in a few health systems, not only in the GCC, but also here. And then we'll be at that point, 12 months from now, it takes 10 months to grow a baby. So the initial stages of our first research study that we're hoping to accomplish.
Can you recommend a book that has influenced you? Are you a reader, by the way, or
I used
not
to
much?
be a reader until I read the book. What does that say? Startup CEO, Venture Deals, and those are the books that I'm looking at right now. I think one of the books that I read was Atomic Habits, and this was
Mm-hmm.
a while ago. And so I think at the end of the day, it just comes down to
That's
like,
fantastic.
yeah, building something, every book I read is freaking self-help or like nothing is fiction. So I can't, you ask me for,
Does us better.
there's no way.
Yeah.
But Atomic Habits is probably one of the books that I was like, if you have, at the end of the day, whether you're corporate, anything you do that is challenging, if you have systems and discipline, if you can have
Break
that,
it down
break it
progressively.
down. Exactly. And that will be so valuable downstream as you navigate even more challenges and grow. Yeah.
No, it's one of my favorite too. Glad that you brought that up. Uh,
Yeah.
so what's a fun fact about yourself that most people don't know? Because probably they meet the CEO of Myri Health all the time, but what's the fun fact about yourself?
So I used to be an all-state singer. I sang a lot. I danced a lot in high school. I played softball, basketball, and track. And I also did pageants to get scholarship money to get through school. So I went to Miss Oklahoma.
Oh, wow. That's really you are, putting a really big benchmark for, a lot of people here.
I think all
Great.
of those things somehow, like I was like, I'm
Yeah.
never gonna start a business. I'm never gonna build a business. And I think everything collectively, because I also did bodybuilding competitions, a few of them. And I think
Mentioned that, yeah.
everything that I experienced, like it's not the actual act of what I was doing, it was more of like what I learned through the habit formation of achieving that. Then full circle somehow came and helped me with my mentality with startup life.
Yeah. Yeah. Yeah, I mean, as they say, like sports and co-curricular, eventually, like you never remember the grades or the subjects like what you were really reading in a book, but it's that whole experiences that you learn. And I think as parents or as children, like we have to work together to create as much experiences and as many things to try. And I think it all adds up eventually.
I think it does. Like I studied a lot of individuals in 2018 when I started to think I might want to build a company. A lot of people don't know this about me, but I studied a lot of athletes. I studied a lot of CEOs and I did a lot of reading around like
Mhm.
how are they built before and how do I strengthen my mind before I go into this like really
Mhm.
crazy space of building something because there's a lot of influence and there's a
Mhm.
lot of rejection. Right. I
Mhm.
always think rejection is a numbers game. It's a velocity game. The more you put yourself out there, the more you're going to get rejected. So I spend a lot
Right.
of time studying that. And those were like the books that I was reading around with athletes as well.
Right, right. Makes sense. Great. Thank you so much, Pinky. It's a pleasure hosting you for last 35, 40 odd minutes and a lot of takeaways. Thank you for being a generous guest, sharing all these great stuff that can be very useful to our audience, who can take some of these ideas and go build themselves. Thank you
Yeah.
so
Thank
much.
you for having me.